Hello and welcome. This lecture is about the basics of health and the role that it plays in society. Now, as we go forward and start thinking about health and communication and other types of ways of addressing health in communities, it's useful to have a background in some of the basics of health practice, what health looks like at a population level, and some of the ideas around what health even is at a basic level. So, start off, I know that definitions are kind of boring, but in a few seconds, I'm going to talk to you about some of the philosophy behind this, and I think that you'll find that much more interesting. But as a basic description of what health is, health has been described as a state characterized by anatomic, physiological, psychological integrity, ability to perform personally valued family, work, and community roles, ability to deal with physical, biological, psychological, and social stress. So that's one definition of health. It's a pretty inclusive idea of what it means to be a healthy person. If you are talking about the idea of public health, which is a term that I use very often, public health could be understood to be the totality of all evidence-based public and private efforts that preserve and promote health and prevent disease, disability, and death. All right. So what we're talking about here is both a broad understanding of what health could be, as well as a broad understanding of the different types of ways that we can use evidence and information to improve, preserve, and promote health, right? So that's kind of some of the frames that we talk about in thinking about health and public health practice. Now, when we think about public health, sometimes it's helpful to have a little bit more of a concrete idea of the different elements to this. And the CDC has put together the 10 essentials of public health. And what those are essentially are saying that public health assesses has assessment. There's three things on the outside with the arrows. That's the assessment, policy development, and assurance elements to public health. Okay. Within those, for assessment, there's monitoring health and diagnosing and investigating health issues, right? Then for policy development, we have informing people about health, educating them, empowering them to address health issues within their communities, mobilizing community partnerships, so really working with those community organizations to address health issues, developing policies around health. And then on the assurance side, we have things like enforcing laws related to health, helping people access healthcare, right? Making sure that that there isn't an unequal distribution of access to health insurance, access to clinical services, etc. You also, in public health, want to make sure that people are providing public health services, medical services, that you have a workforce that's prepared to offer those services and is competent in doing so. And then also part of public health is evaluating the efforts that we make to try and ensure that people are healthy. And that also connects to the 10th component, which is in the center, which is research. And research crosses all of those different domains in that helps us understand how to do all those elements better. So that's kind of the way that the CDC at least describes what public health does. Now, the reality is to do those different 10 things, you have to have a lot of different expertise from a lot of different areas. You know, we often think about fields that are very clinical when we think about health, but you know, business is also related to health. In terms of thinking about business practices that affect health, in terms of thinking about the economics of health type issues, the ways that different services could be offered to ensure health. So, you know, having good access to food is connected into business. You know, I could pick any of these different sort of disciplines and fields, be it the arts or anthropology or history or sociology. These are all fields that have important things to say about health, and that if you looked at people who are doing public health, that you would find people who had those different backgrounds. So it's helpful to think about health as being a very wide field where everybody has something to contribute to it. And regardless of what your particular interests are, either personal or professional, I could probably draw a connection for you between that and a public health area. So I gave you some definitions of health, which, they're okay. They give you some idea of what we're talking about with health. But I actually think that stepping back and thinking about it from a more philosophical perspective is actually pretty helpful. So I like to use I use a framework which talks about 4 different models for what health are from a philosophical perspective. And these come from different historical and sort of social perspectives on health. The oldest model of this, so the 4 models are the moral model, the well-being model, the medical model, and the social model. So the oldest among these is the moral model, and that's the idea that someone's health is really a reflection of a person's internal moral state. Okay, so that might seem a little unfamiliar, but when we think about historically how in religions and currently in some religions, it's seen that if you become sick, it's seen as being a punishment for sins of various sorts, ill deeds or thoughts or behaviors of various sorts, right? And that's a perspective on health that has existed for a very, very long time. And sometimes that's the fault of the person themselves or viewed in that way. So someone gets blamed for the illness that they have. Sometimes someone might get sick and the sickness is seen as being a blame to their parents. So their parents did something wrong, and having a sick child is seen to be a punishment on the parents for having done something wrong. So it's in certain perspectives on health, this actually holds a lot of sway, and it still does everywhere around the globe in different ways and different magnitudes. So sometimes it's couched in religious context, and sometimes it's couched in more of a stigma context. So sometimes we see that certain stigmatized groups get blamed for their behavior. So if someone has a sexually transmitted infection, very often they get blamed for that, for having sex with people, or having a lot of sex with people, right? So that is another form where you can blame. There's stigma against sexuality that then can be turned into blame for getting sick in some way or another. And this, we see this in mental health. We see this in many different forms of stigmatized illnesses that at a population level. And I'll talk a little bit more about this, but it has distinct challenges for communication and for working with folks who have that framework for thinking about health, right? Because sometimes it's applied from externally, so people get blamed by others for their health state, and sometimes people blame themselves for their health states as well, right? So it can be internalized too. Here's another way of thinking about health, and this is broadly termed the well-being model. So in this view of health, health is a state of complete physical, mental, and social well-being. And this is the WHO document, I think in the 1950s, that sort of presented this broad view of health. And many people like this view of health because it is broad, right? So it's pretty inclusive. And it feels intuitively holistic and connected to a lot of folks, right? Now, there's advantages to this because this gives you a lot of flexibility for thinking about what health could be. Now, I want to bring up a challenge or concern about it, which is that when your definition of what health is so broad, a challenge to that is everything becomes health. So how do you think is someone's health as it relates to having cardiovascular disease the same as someone's health as it relates to having access to libraries, right? So you could argue that having access to the library is a health issue if you think about complete physical, mental, and social well-being. And I certainly would argue that it's important. But some people argue that having such a broad definition of what health is kind of a disadvantage because it makes it hard to be clear about your understandings of what health, what falls under the domain of health. There's another model, which is called the medical model. And this is actually the model that tends to be the default in health practice. And it's a view that being healthy is essentially a state where you're able to carry out all the quote unquote normal functions of being human without any difficulty, right? And here we're using sort of a normal definition. And this is the Vesuvian Man, the picture there, Da Vinci. There are some advantages to this. One advantage to this is it's a pretty tightly defined way of understanding health. It allows you to rank different health challenges because you can compare it to this normal function, for example, and say, this one has more serious impact on someone's function than another one. And it also provides a clear outcome where you can say, if you actually achieve that, bringing people to normal functioning, then you've actually achieved your job. You've actually helped people be healthy, right? Whereas in some of the other models, you can never actually achieve health, right? Now, there's challenges to this too that are pretty important. You'll note the word normal there. And you'll note the picture down there, which is a picture of a white man. There's a history of white men being the standard of normal for medicine, right? And that is a sexist and racist history. And when we think about practices or approaches that use some sense of normal, you have to be really critical of who gets to be the normal, right? And what happens when you're someone who never is going to be normal in a certain sense? Are you always considered to be sick? Even if you like and are happy and have well-being in your functioning, right? So that's a real challenge to this medical model, even though the medical model is very prevalent often in healthcare. There's also what we call a social model. And I think that this is very much a reaction and response to the medical model. And in this view, health is essentially a function of culture and society, right? So health is a social category which varies widely depending on how culture is set up. So what does that actually mean? It's essentially saying that someone's health really depends on the world that you live in, on the social context in which you're in. And I think here's an illustration that I think clearly describes that. So imagine that there's two worlds, all right? One world, all houses or all buildings have stairs to get into them. In world number two, all houses, all buildings have ramps to get into them, all right? So two worlds, they all have houses, but they have different ways of entry. Okay, imagine you use a wheelchair, all right? Which world would you want to be in? Which world would impact your well-being the most? Well, the world where to get into any buildings, you had to go upstairs, that would be a world that would be very difficult, and that would dramatically impact probably your physical health and mental health and well-being in general, right? Because you'd have all sorts of barriers to functioning in society. Whereas a world in which all houses had ramps, your health and well-being would be substantially better in terms of access and capacity. So the point that I'm making here is a person in the wheelchair, nothing has changed about them. They're the same person in the same wheelchair. What has changed is the world that they live in, right? So the society, the choices that we make as a society actually in important ways actually determine the health of a person, Does that make sense? The structures around us actually determine our health without us as people changing at all. So that's important. There's a lot of examples of the way that society impacts health. So there's the sick role. If you're seen as being sick, you're expected to behave in certain ways, and if you don't behave in that certain ways, and you don't take medical advice, for example, you're seen as being a bad patient, right? And that's seen as negative, and there's a lot of stigma against that. These are social roles and expectations based upon people's health status and physical state, right? There's also a way in which health is provisional, right? So I wear contact lenses. When I have my contact lenses, I can do a whole lot of things. When I don't have my contact lenses, in a world where contact lenses didn't exist, for example, my life would be very different. So in some cases, when we're talking about medical technologies, your health can be given or taken under certain circumstances. And the giving or taking is largely based upon social decisions and social constructs. So you'll hear terms like social construction of health, right? So what social construction means is that the society actually creates reality in certain ways, all right? So you can socially construct all sorts of things across society, and health is one of the things that is socially constructed. Now, there's criticism of this approach too. One is that it becomes hard to define health if you take the social model. So it becomes hard to prioritize different types of health, right? Some people argue, for example, that it doesn't take seriously, or it doesn't really give us tools to address suffering in different levels, in different health states, right? So there are challenges to this approach too that get talked about as well. So keep those in mind. So there's a reason that I went through some of the philosophy of this, and this is that the truth is that most people generally have preferred models among those four general ones, and there might be other ones too, but those are the ones I'm familiar with as general overarching models. So we tend to have ones that we tend to default to, right? Now we sometimes switch between them in different circumstances. Someone who uses a medical model most of the time might sometimes stigmatize certain people too. That happens in healthcare. So people who are there's a big issue with people who use injection drug use, for example, sometimes has stigma applied to them in healthcare contexts, for example, right? So knowing that people generally have certain ways of approaching the world and approaching health is actually important for when we're thinking about communication. Understanding where they're coming from, right, is very important. So if you're talking about health and you're talking about health with somebody and you're using the medical model to talk about health, but they're thinking about health from the moral model, you two are not having the same conversation. You're not actually communicating because you're not talking about the same thing. You're not on the same wavelength. You're not connecting in the way that you need to actually have a meaningful conversation. So the reason this is important is being aware that people might be coming at health and health practice from a very different perspective than you. And that you have to actually elicit get some understanding from them of where they're coming from to actually be able to be useful to them and helpful to their decisions as they move forward around their health and behaviors. So that's why this sort of abstract philosophy and these definitions, that's why it's actually concretely, practically important to understand these differences. All right. So what are some factors that impact risk for different health states, right? There's actually quite a lot, and it's helpful to just see in a general way what these factors are as you think about what different elements of health you want to focus in on as you go forward in your career, right? So here is one way of looking at health, and this is essentially a disease model for looking at health, and this is looking at causes of death as defined by the National Vital Statistics. Okay, so here are the top 10 leading causes of death in 2018 and 2019, the dark blue and light blue bars. And the top 10 are heart disease, cancer, unintentional injuries, chronic lower respiratory disease, stroke, Alzheimer's disease, diabetes, kidney disease, influenza and pneumonia, and suicide. Right? So those are the leading causes. Now, you'll note among those, heart disease and cancer really make up a large portion of causes of disease-based causes of death in our society. And these causes vary. So unintentional injuries differ substantially from heart disease, which differs from infectious disease like influenza and pneumonia, right? And so they have different causes. So commonly, we define these as non-communicable diseases, which are ones which can't be passed from one person to another. We have communicable diseases, which are diseases which are passed from one person to another. And then we have environmental diseases. Environmental diseases are diseases that relate to toxins in our environment or factors that are around us that cause death. So the main one on this list, unintentional injuries, is often seen as environmental because it's influenced by your surroundings. Okay. Now, one thing I'll note is that the types of things that kill people are actually different than they used to be. In 100 years ago, a bit over 100 years ago, out of the top 10 leading causes of death, 4 of them were infectious diseases, right? So we have had a shift where a lot of infectious diseases we've had a lot of luck working on those infectious diseases to prevent death. Now, what's going to be different for the last 2 years is when the data comes out for 2020 and 2021, we're going to see COVID-19 as coming in that top 10, certainly. And that's an unfortunate move back towards times where, infectious diseases had a much larger impact. Now, there's another way to think about diseases or death and health impacts, and that is to look at further upstream causes. And these are called major risk factors for death, okay? So major risk factors are things that are a little bit more upstream, right? So things like smoking, right? Or diet, okay? Or air pollution, okay? So these are different risk factors which may not be the disease that causes a death, but are often things that are good to know about because they're the things that lead to those deaths. And there are also things very often that we can actually take action around, right? So you can quit smoking to address that risk factor for death. So this is also a very helpful way of thinking about health risks when we think about pragmatic ways of addressing risks. Okay. Now, again, as we think about those upstream factors, thinking carefully about where illnesses come from is important. So contributing causes are the direct association with causing disease, something more like the causes of death I talked in the 2 slides ago. All right. So that would be, if you're drowning, it's water entering your lungs and that stop your breathing, right? So that would be the cause of death, right? There's another way of thinking about health, which are called health determinants. And these are upstream factors, things that happen earlier in someone's life that determine whether not someone will be exposed to these contributing causes and what their physical response to the contributing causes are, right? So, in the drowning example, if someone lived in a community that had pools and everybody learned how to swim, well, someone who had had that training maybe wouldn't have drowned, whereas someone who never had access to a pool might drown, right? So in some ways, that might be a determinant of whether someone drowns in a certain situation, right? So we're thinking determinants are really important because they help us to look at social and physical and environmental factors that are upstream that we can actually sometimes make a huge impact on whether someone actually dies of a disease, one disease or another. So what are these determinants? Well, there's an abbreviation for them called Big GEMS, which stand for behavior, infections, genetics, geography, environment, medical care, and socioeconomic and cultural factors. Now, I think intuitively, if you look at this list, it will kind of make sense to you, right? These are all things that sort of early on, if you're exposed to different types of behaviors, etc., could help determine whether or not you actually die of one disease or another, right? So behavior, again, exercise habits, smoking or not, all sorts of different things are in terms of people's individual behaviors, social behaviors, actually make a huge impact on health outcomes, right? We also have infections, certain types of infections, like HPV. You know, if you get an infection, it can, for example, later on in life, increase your probability of developing cancer, right? So infections can actually make someone more susceptible to a disease. Genetics has a major role in health, actually. A lot of diseases have a substantial genetic contribution to risk. Well, you know, there are conversations about how we can get more information about people's risk based on genetics and actually engage in prevention for that to progress into disease. So different people, you know, if they're exposed to different toxins, for example, if they have certain genetic traits, are more likely to develop a risky disease like a cancer. So genetic can be that upstream factor. Geography can make a really big difference. When you live in certain areas, you're much more likely to get malaria, for example, right? So the physical traits around you make a difference. Geography can influence the types of natural disasters you are impacted by, for example, earthquakes, right? So it can make a really big difference. And knowing where someone is from is helpful for understanding what risks they have. There's also the environment. So air quality, for example, right? Or different toxins you're exposed to, the built environment you are, you know, injuries in terms of, you know, what types of risk factors for car accidents do you face in your environment. Those are all really important for understanding how likely someone is to die of some cause or another. You notice that one of the upstream major risk factors, for example, was air pollution, right? It makes a huge difference for cardiovascular disease and a whole bunch of other health outcomes, respiratory disease. Another is medical care. So the quality, if someone does get sick, the medical care that they receive or don't receive is highly predictive of the future sequelae of what happens, right? So if someone doesn't get the care that they need for, you know, if they don't get screening for cancer, they're much more likely to die of have that progress to a more serious situation than someone who isn't. So that is a major predictor as well. And we know that in our society, access to healthcare is not in any way equally distributed. There's huge disparities in healthcare access that we need to keep in mind. And then there's a whole range of societal, economic, and cultural factors that influence health. The ways that your peers think about taking risks, think about smoking, for example, the way that people think about mental health. These vary substantially between different communities. And the types of access you have to economic resources makes a huge difference in terms of your health outcomes, as I'm going to show in a few seconds. So these are all factors that are really very important for understanding health and the progression of disease and ultimately mortality. So let's talk for a few seconds about how society influences health. So when we look at the different factors that influence health, here's just a chart showing the different levels of risk related to different types of factors. Now, what I will say is this is a helpful chart for looking at the composition of risk, but don't take it too seriously. The way that you define things makes a big difference for how large each of these different slices are. So this will vary depending on how you do the analysis. But generally speaking, this is kind of a helpful rule of thumb for thinking about risk factors. So genetics is, as I mentioned earlier, a major factor influencing health, as is access to healthcare, also really crucial and important. But we'll see two elements to this graph which are highly socially influenced, and one social environmental context that one is in, right? So that's cultural factors, environmental factors like it could be your environment, but sometimes it's things that are culturally related, like the way that your built environment is set up. For example, whether you have ramps or stairs, right? And then there's also individual behavior, and we know that individual behavior is highly influenced by our culture and social factors, right? So individual behavior in those cases might be smoking or not, for example, right? So these are a very large majority of premature death is related to factors which have social elements, okay? So it's important when you think about health communication. Remember, health communication is how, or communication, and health communication being a subset of that, is how we connect with one another. It's a root function of society, right? And when we think about individual behaviors, when we think about culture and community, those are all related to how we talk about and think about health, especially when we're thinking about health outcomes, right? So health communication plays a crucial role when we're thinking about preventing premature death. All right, so when we think about these social determinants, what are the ways that social factors influences health? Well, when social status influences access and other types of abilities to have control in your life. Having social support and alienation has a huge impact on mental health and access to resources. The food that we have makes an impact on our well-being and nutritional status. Housing has a huge impact on people. People who lose housing are at much greater risk for a wide range of different health conditions. Education makes a huge difference, both in terms of its relationship to social status and economic status, but also in relationship to knowledge about health in general. Work makes a huge difference, both for the economic connections, but also gives you a range of different opportunities and connections. Stress has both mental health implications, and it also has physical implications. So people who are under higher stress actually have physiologically higher risk for getting diseases of various sorts. Transportation makes a difference. So can you get to get to the hospital if you need to, right? Can you get access to the things that you need in your daily life, like food or other things? The place that you live makes a huge difference. What types of access do you have? Do you live in a place where you feel comfortable going out and running, for example, or you feel like that isn't safe in the community that you're in, right? And access to service is hugely important. So are there services in your community which you can use as a resource when you need to? And these social determinants are all really important for helping assess whether someone is or is not more likely to develop a disease. Now, we know that when we look at society, that our risk factors on those different social determinants that we talked about are not equally distributed. We live here in an area that has tremendous divides. So I'll show you some data from Snohomish County and from King County. And what you'll see is that when it comes to the average median household income in Snohomish County, if you look at the different areas of Snohomish County, the average is about 70,000, 68,000. But there's a difference. One area in Mill Creek, the average median household income is about 100,000. North Everett is about 55,000, right? That's almost double. That's a huge difference in terms of access to resources, right? And that's not an accident, right? Why, if everything was equal, all these different areas on average would even out to be the same household income. That isn't true. There's a whole range of social reasons why there's a difference that we're seeing there. And we all know that that's a big deal, right? Similarly, we can look at life expectancy at birth, right? In Snohomish County, we have a difference of almost 10 years. So in Bothell, the average age is about 83, right? Tulia Bay and North Coast, the average is about 73, right? So a 10-year difference. It's disturbing, frankly. It should be disturbing. 10 years is a lot of life to lose because of the way that we set up our society. So, there's a lot to say about that. But remember that these differences are a function of how we've set up our communities, the function of how we set up our economy, a function of those 10 social determinants of health, right? So you can also look at King County, and it's not just location. It's also, as we know, connected to a range of different factors, discrimination and social factors of various sorts. In this case, we can look at racism and see the impact of racism in our communities on quality of life. So on one side, with the dots, you see the quality of life indicators, which is a measure of how people assess their own quality of life. And you'll see the darker dots indicate below average, and the lighter green dots indicate above average. And then if you look at that and compare that to the percentage of people of color in a community, you'll notice that there's a lot of overlap. And that overlap is due to pervasive and systemic racism in our communities, right? So this is just a very simple and basic sort of illustration of these things. As you dig into this data, you will see these types of themes show up all across health data pretty consistently and reliably. So this is a major consideration for public health, and public health has a lot of opportunity to shift this, as does health communication. Health communication gives us the opportunity to address some of these challenges, address these social disparities and determinants, right? And also motivate people to work for a more equitable society. So just quickly to go through a couple of these different types of factors that influence health, right? One is socioeconomic status, how much money you have, right? So it's associated with a wide range of different things, from the types of space that you get to live in, to whether you're exposed to higher risk behaviors, to whether or not you work in environments where you might be exposed to more toxins. So you can look at this list and read through it and see that there's a lot of different ways that having more access to money and resources can really influence your likelihood of being put in a position where you're more likely to get ill. There's also a range of different social influence, your ability and your capacity to influence your social environment. So shaping this can shape within your community, it can shape the norms of what is expected in your community, right? So the culture that you're in, the community that you're in, influences behavior. It pushes people towards certain ways of enforcing certain behaviors as well, right? So that's social control. And in some communities, you don't have access to doing certain things or behaving in certain ways. It also influences stress and stress response. So in cultures and communities, stress is often related to social hierarchies, right? So these are all things that have an influence on someone's health status, right? And then we can have culture and religion, which also has impact on people's health behaviors, how people think about health, how they think about symptoms of disease, and what those symptoms mean to them. It also influences what types of solutions they are willing to engage with. There are certain communities for which certain types of medical approaches are not seen as being acceptable. And thinking about how people actually, when someone does get treatment for a disease, culture can actually influence how well that actually works, based upon how that culture interacts with the recommendation for the solution to that health issue. Great. So that's a really basic overview of some of the things that we think about when we think about health. I think it's really useful to understand that health means different things to different people, and also that we can think about health in different ways. We can think about it as a disease, as a direct cause of death, for example. Or we can think about something that happens 20 years before a health issue shows up as actual symptoms, right? And we can also, and it's crucial for us to not just think about health as being a physiological state. It's also highly interactive with our social environment. And as we know, social environments has a foundation. One of its foundations is in the way that we communicate and connect with one another. So that's some food for thought for the future. I hope it's helpful for giving some general framing for thinking about this. So we'll talk about this more in the future. So take care. Hope it is useful. And be well, everyone.